coming across as very strident or even partisan. Yet we really want to try to avoid that today, because this is not, or should not be, a partisan issue. This is an issue where there should be broad bipartisan support in the legislature, that the legislature should stand up and protect its rights to set healthcare policy in this state. But to try to avoid coming across as partisan or strident, let me read what a couple of nonpartisan legislative agency people have had to say about this bill. First, the Legislative Fiscal Bureau puts together a list of non-fiscal policy items in each budget bill. Often the Joint Finance Committee starts off the budget process by stripping those non-fiscal policies from the bill, because those kinds of things just don't get an adequate airing in a bill, in a budget process, especially a budget that's being passed in the space of about a week. What the Fiscal Bureau said in listing these Medicaid provisions as non-fiscal policy is that, quote, they removed the entire legislature from determining substantial elements of the medical assistance program. That's not our conclusion, that's the Legislative Fiscal Bureau's conclusion. There's also what's called a drafter's note that was put together by the woman who drafted the bill, who knows this bill better than anyone else does. She, in her drafter's note, she raised questions about the constitutionality of such a sweeping grant of authority from the legislative branch to the executive branch. And in there, she said that this legislation, quote, would allow DHS, the Department of Health Services, to change any medical assistance law for any reason, at any time, and potentially without notice or public hearing. Again, this is not our conclusion. This is the conclusion of the attorney who drafted the bill. To sort of get away from partisanship on this, I want to try one other thing, which is to kind of turn the tables, do a little role reversal here, and imagine that President Obama were to propose that as a way of addressing the deficit, that on a fast-track piece of legislation that needed to be passed in a week or two, that he would, and that in order to get a hold of the nation's very, very substantial federal deficit, that we ought to cut Medicare. And suppose he were to propose cutting Medicare by handing over to Secretary Sebelius the authority to write rules, not regular rules, but emergency rules, changing any part of the Medicare statutes, going into those statutes and inserting from place to place that, notwithstanding the law that has been developed carefully by Congress over years and years, that all of those provisions could be superseded by whatever the Secretary decided. And suppose that instead of having the Secretary use the regular rulemaking process, that this legislation granted her the authority to use the emergency rulemaking process with little public input, or virtually no or extremely little legislative oversight. And suppose that instead of using the regular emergency rulemaking process, which sets time limits on those rules and requires a finding of emergency, that this legislation did not require a finding of emergency and allowed emergency rules to be in place until 2015. Now, if in that scenario you just substitute Obama for Walker, if you substitute Medicaid for Medicare, and if you, and just making those changes, that's what we have here. That's exactly what the governor is proposing to do. And if you can imagine that scenario, imagine what would happen when the public found out. Imagine the Tea Parties. Imagine all the Republicans and all the Democrats. Imagine the rallies around the country at a power grab like that. Those rallies would make the 100,000 people on the square yesterday look like a picnic. So I'm here today, well, and just, there is one distinction between the scenario I laid out at the federal level and what the governor's proposing, and that distinction is basically that we do have one protection. Federal law sets certain minimum requirements that states have to meet. But that protection may be of little consolation for two reasons. First of all, Congress, or the House of Representatives, is attempting to to repeal those protections. Secondly, this bill would direct the Department of Health Services to apply for federal waivers to exempt us from those federal requirements. So, and there is, for the most part, I'm sure many people here want to know specifically what the bill's going to result in. The fact of the matter is we don't know. The bill doesn't tell us. The Secretary of the Department of Health Services will decide. There is one exception to that, though. What the bill says, and this is kind of the best worst case, or I should really say the least bad case scenario, and that's that if the state by the end of this year does not get a waiver that exempts the state from the current restriction on reducing income eligibility, the state would be able in July of next year to reduce eligibility for adults, for parents and childless adults, from the current 200% of federal poverty level to 133% of poverty. What does that mean? According to the Fiscal Bureau, that would result in the elimination of coverage for about 63,000 parents and about 8,000 childless adults. And that's the best case scenario. So in short, I just want to reiterate what Ken said, that we're really here today not only to talk about protecting healthcare rights, but to talk, more importantly, about protecting basic democratic rights. And I'd like to close with stealing from the statement of the Farmers Union that's also with us here today. Their closing remarks, I think, really sum up where all of us are on this issue. Quote, "It should be the legislature, not unelected agency officials, who decide the future of medical assistance programs in our state." That's a principle that both parties in the legislature should easily be able to embrace, and we're counting on them to embrace that principle. Thank you.